Hello. All right. ये इको क्यों कर रहा है? अच्छा. Am I audible and visible, students? Can you let me know, please? Good evening. All right, ठीक है, यहाँ पे दिखेगा मुझे ना. Yes, Guy Tonde, very nice. All right, hi. अच्छा, आप लोगों को मैं देख भी पाऊंगा क्या? हाँ जी, okay, I can see people also. ठीक है, great. चलिए स्टार्ट करें. Shall we start? Good evening, everyone. Just give me a second. All right, guys, let's start. So, I'll be covering some important topics which are routinely asked in the FMGE examination, and I'll also be discussing some of the important PYQs. I hope I'm well audible and clearly visible. Right. So let's start. Let's start with some of the basics. All right. Now this term MSc, Mental Status Examination, you will get to see this term again and again, and often the question is asked in the examination. The typical question is, the clinical examination in psychiatry is called as. The answer is MSc. So what is MSc? The clinical examination in psychiatry is MSc. Typically, the question that comes in the exam is, the clinical examination in psychiatry is called as. Option 1, MSc. Option 2, MMSc. Option 3, PSc. What would be your answer? क्या आंसर रहेगा? MSc. ठीक है. So please remember, the clinical examination in psychiatry is called as MSc. Now MSc has got certain standard components. So let us talk about the components of MSc. One of the important component of MSc is perception. ये perception क्या होता है? What is perception? Perception क्या होता है? Any information that is coming through a sensory organ is called as perception. Like we see, it's a visual perception. We hear, it's an auditory perception. In psychiatry, we are more concerned with the abnormalities of perception. So there are two important abnormalities of perception. We have got illusions and we have got hallucinations. So illusion क्या होता है? First of all, what is an illusion? If I say that I see a black pen, I see a black pen, what is it? Is it a normal perception or abnormal perception? If I say I see a black pen, I am having a white pen in my hand, but I say I see a black pen. It's an abnormal perception. In the second case, I don't have anything in my hand, but I still say I see a black pen. So in both examples, I am having abnormal perceptions. In the first case, I had a white pen in my hand, but instead of the white pen, I saw a black pen. Whereas in the second case, I have nothing in my hand, but I still saw a black pen. So the first one is an example of illusion. So what is illusion? It's a false perception of a real object. Yes, misinterpretation. False perception of a real object. Right? And what is hallucination? It is false perception without any object. There is no object, there is no stimulus, but still we are having a false perception. So typically the question that comes in the exam is a man is walking down a dimly lit street. एक street है जिसमें की light कम है, and the man mistakes a rope for a snake. Rope को snake समझ लेते हैं वो. What is this called as? So क्या है ये? It is an example of illusion, false perception of a real object. ठीक है? All right. There are certain specific hallucinations जिनको हमने specific names दे रखे हैं, and they are also asked in the exams. अच्छा, YouTube पे भी है ना? अच्छा, हाँ, अभी I think the initial 30 minutes we are also live streaming it on YouTube. Okay. So I can see, sir, can you please repeat about the perception? So perception is any information coming through a sensory organ, which is then interpreted in the brain, right? So we have 5 basic perceptions: auditory, visual, olfactory, gustatory, and tactile. All right, let's talk about some specific hallucinations. Now, there are 2 hallucinations which occur in relation to sleep, right? The first one, so when you look at this term hypno, so kya hua? Okay. So anyways, so pen has stopped working suddenly. So क्यों? एक बार डिफरेंस किसके बीच का मनीष? Difference between hallucinations and illusions. Illusion is the false perception of a real object. I mean, there is some kind of stimulus which is being interpreted in a false manner. That is an illusion. For example, if there is a pen and instead of pen I saw an umbrella, that would be called as an illusion. And what is hallucination? In case there is no object, there is nothing, but still the person is having a perception. For example, if I look at my hand and I say I see an umbrella, in this case I've got nothing in my hand, but I'm still seeing an umbrella, that is called as a hallucination. All right. So false perception of a real object and perception without an object. So we're talking about the 2 types of hallucination in relation to sleep. First hallucination occurs while going to sleep. The one which has got the word go, it is called as hypnagogic hallucination, occurs while going to sleep. And the second one occurs while getting up from sleep. Right? Hypnagogic and hypnopompic. And in which condition do we see these 2 kinds of hallucinations? किसमें मिलती हैं दोनों hallucinations हमें? बताइए. What is the answer? Yes, both of them are features of narcolepsy. Both of them are features of narcolepsy. Now, this reflex hallucination is extremely important. In reflex hallucinations, what happens is the stimulus is in one modality and it causes or it produces hallucination in another modality. So what is the meaning of this? The stimulus is in one modality and the hallucination is in another modality. For example, if I say, whenever I see bright white light, if I'm saying whenever I see bright white light, what is the modality in which the stimulus is? It is in visual modality. Whenever I see bright white light, I start hearing the voice of, say, Deepika Padukone. Whenever I see bright white light, I start hearing the voice of Deepika Padukone. Now, the voice of Deepika Padukone is an auditory hallucination and it is occurring in response to a visual stimulus. So, stimulus is in visual modality, hallucination is in auditory modality. It is called as reflex hallucination. And reflex hallucination is typically seen in patients who are having LSD intoxication or cannabis intoxication. When a patient who has been intoxicated with LSD, when he comes to the OPD, he frequently says, "Doctor, I can see the voices and I can hear the colors." Seeing the voices and hearing the colors. What is this abnormality? It is a reflex hallucination. Right. ठीक है, चलिए आगे बढ़ते हैं. So the next important component of MSC is thought. Yes, it is a type of reflex hallucination, is a type of synesthesia. What is the meaning of the term synesthesia? Syn is combination, aesthesia is sensation. Because a combination of sensation is happening over here, that is why it is also called as a synesthesia. Now let's talk about the next component of MSC, which is thought. Thought is soch, whatever you are thinking, soch. Now, when we talk about the abnormalities of thought, we talk about different components. We have abnormalities of the stream of thought. We have abnormalities of the form of thought, content of the thought, and also possession of the thought. When we talk about the abnormalities of stream of thought, basically we are talking about the speed of thinking. The speed of thinking. Now, if I say, my name is, all these are important for NEET 2. So in last few years, the questions that are being asked in NEET and FMG are almost the same. So yes, it will help you in the NEET 2. So if I say, my name is Dr. Praveen Tripathi. I did my MBBS and MD from Delhi. Currently, I'm working as a psychiatrist in Delhi. What is the speed of my thinking? Is it normal speed? Is it increased speed? Is it decreased speed? कैसी speed है ये मेरे बोलने की? Normal, increased or decreased? नॉर्मल है, राइट? अगर मैं सेम थॉट को ऐसे बोलूं, माय नेम इज डॉक्टर प्रवीण त्रिपाठी, डिड माय एमबीबीएस एमडी फ्रॉम दिल्ली, वर्किंग एज अ साइकियाट्रिस्ट इन दिल्ली, अभी कैसी स्पीड है? इट इज इंक्रीज्ड, राइट? सो बेसिकली इन द डिसऑर्डर्स ऑफ स्ट्रीम ऑफ थॉट, व्हाट हैपेंस इज द स्पीड ऑफ थिंकिंग चेंजेस, and the change in the speed of thinking would reflect in the speed of speech. So in flight of ideas, what happens is, the name itself is flight of ideas. The ideas are flying. If the ideas are flying, the speed would be increased or decreased? The speed would be increased or decreased? The speed is increased. In the flight of ideas, the speed is increased. So basically what happens is, the ideas are coming in my mind at a very rapid rate. They are coming in the mind very fast. And because the ideas are coming in my mind at a very fast rate, my mind does not get enough time to make proper connections. So my mind starts making random connections, right? So thoughts follow each other very rapidly, and the connection appears to be due to chance factors such as rhyming. For example, a patient comes and says, I live in Delhi, I like eating jelly, my cat has a big belly. What is the relation between all these three? It is rhyming, right? And in which clinical condition do we get flight of ideas? We get it in mania. Okay? All right. After the stream of thought, now this is a question which has been asked in the FMG examination on a couple of occasions, and for that matter, NEET, PG, ICT, everybody asks this question. Disorders of the form of thought. So the stream of thought was about the speed of thinking. The form of thought is about the organization of thinking. The form of thought is about the organization of thinking. Whether the different components of thoughts are properly connected to each other or not. This is the meaning of form of thought. Abnormalities of form of thought are called as formal thought disorders. Abnormalities of form of thought are called as formal thought disorders. So there are many types of formal thought disorders. Let us talk about three most important types of formal thought disorders. Say if there is a thought 1 and there's a thought 2, and the thought 1 has two components, A and B. Now, if the connection between thought 1 and thought 2 gets broken, if the thought 1 is not connected to thought 2, if the organization of thought is broken in such a way that the thought 1 is not connected to thought 2, this is called as derailment. Thought 1 is not connected to thought 2. For example, if I say, my name is Praveen Tripathi and I am a doctor, Beijing is the capital of China. My name is Dr. Praveen Tripathi and I am a doctor. Thought 1, Beijing is the capital of China. There is no correlation between the two. So this is derailment. Thought 1 is not connected to thought 2. Second type of formal thought disorder is loosening of association, in which what happens, two components of the same thought lose connection. So for example, my original thought was, my name is Dr. Praveen Tripathi and I am a doctor. The first component, my name is Dr. Praveen Tripathi, is well connected to the second component, I am a doctor. Say I develop loosening of association. I will say something like this. My name is Dr. Praveen Tripathi and it is going to be the biggest blockbuster of this year. My name is Dr. Praveen Tripathi and it is going to be the biggest blockbuster of this year. What is happening here? Component A of thought 1 is not connected to component B of thought 1. This is loosening of association. And the third one is called as incoherence or word salad. In incoherence or word salad, what happens is the complete thought is disorganized. The organization is completely lost to the extent that it does not make any sense. For example, if I come and say, my Praveen, okay, China, bye. My Praveen, okay, China, bye. This is an example of incoherence. What is the meaning of incoherence? It does not make any sense. So this is the third level of formal thought disorder. So please remember these names: derailment, loosening of association, and incoherence. They are the types of formal thought disorders. All right. So we talked about the stream of thought. We talked about the form of thought. Let's talk about the content of thought. Now, this is a very important question. Delusions are disorders of content of thought. What is a delusion? Delusion hota kya hai? It's a false belief. Patient has a false belief, which is firm, fixed, and unshakable, which means even when you give evidence to break that belief, even then the belief does not break. And the belief is not explained by the social and cultural background of the patient. Correct? Right. Even when the evidence is provided, the belief does not change. For example, say a rickshaw puller develops a delusion that he is the richest man on the planet. A rickshaw puller develops a delusion that he is the richest man on the planet. It's a false belief. But to call it a delusion, you will have to give him evidences. For example, you show him his bank account and you tell him that, look at your bank account, you hardly have any money. You don't have your own house. You don't own anything. So when you are telling him all these things, basically you are trying to give an evidence to break his belief. But even after that, he says, no, I'm the richest man on the planet. And even this is not enough. You also have to see whether his background explains his belief or not. For example, I mean, it is possible that he comes from a religious group or he follows some kind of guru or baba, where, in that group, people believe that being happy is equivalent to being rich. I mean, that's possible. So you also check his background, that does he belong to any such background? And you find out that no, that is not the case. So false belief does not break when you give evidences and it is not explained by the background. Only then you call it a delusion. Why is this background thingy important? In our country, there are many people who follow different kind of, religious leaders. And many people believe that a particular leader is equivalent to God. But you can't call that belief as delusion. Why? Because his belief that his religious leader is equivalent to God is explained by the background of the person. So this is the importance of this third thing. So let's talk about the types of delusions. The most common type of delusion is delusion of persecution. What happens in delusion of persecution? What happens in delusion of persecution? Hanji, kaun batayega? What happens in delusion of persecution? Basic. Yes, Vijay. And yes, Lupriya Mankar. Yeah. So the basic belief is that somebody wants to harm me. The patients may say different thing. One patient comes and says that my family members want to kill me. What is it? Delusion of persecution. Second patient says, my neighbors are hatching a conspiracy to take away my property. What is it? Delusion of persecution. Third patient says, government is after me. CBI is following me. RAW is following me. What all of this is? It is all delusion of persecution. The basic theme is somebody wants to harm me. The second is delusion of reference. What happens in delusion of reference? Everything is in reference to me. Things are happening in reference to me. For example, if two students are talking, they are talking about me. If somebody is smiling, he is laughing at me. If somebody is wearing a red t-shirt, he is giving me a signal that shut up. Everything has a meaning and it is related to me. Right. Then we have delusion of grandeur or grandiosity. In grandeur and grandiosity, what happens? The patient believes that he has got some special kind of power or some special kind of role or some special kind of identity. Patient may say that I'm so powerful that I can lift an entire train with my bare hands. Or patient comes and says that I have been sent by God to spread the message of peace and love. So power, role, or identity. This is your delusion of grandiosity. Correct. All right. Now, this question was asked in your FMG examination. So we are talking about the higher mental functions. We are focusing on the things that have been asked in the exams. So first of all, what is attention? What is attention? For example, if you are listening to this lecture live, multiple things must be happening in your room. You are looking at your phone or iPad, whatever it is. At the same time, the air conditioner must be making some noise. Somebody might be talking in your home. But what are you trying to do? You're trying to not get distracted by those things and listen to what I'm trying to say. I hope you are doing that. So basically what you're trying to do is you're trying to attend to a specific stimulus without getting distracted. This is what is attention. And how do we test for attention in a patient? We do what is called as digit span test or digit repetition test. Basically, you tell the patient that, look, I'll be saying certain numbers and you have to repeat the numbers after me. And then you say 2, 5. The patient has to say 2, 5. Then you say 3, 4, 8. Patient has to repeat after you 3, 4, 8. And then you take it to the 5-digit sequence. So you say 4, 2, 1, 9, 6. Patient is supposed to repeat it 4, 2, 1, 9, 6. If the patient can repeat at least 5 digits, then we say that the attention is intact. So this is called as digit span test. Now in the last year examination, this question came. The question said that a doctor asked the patient to serially subtract 7 from 100. What is he trying to test? So basically what you do is you tell the patient, you have to subtract 7 from 100. And whatever is the result, you have to subtract 7 from that. Whatever is the result, you have to subtract 7 from that. So 100, 93, 86, 79, right? 72. So patient has to serially subtract. If he can do it 5 times, then we say that patient has intact concentration. What is concentration? Ability to sustain the attention. Right? This is concentration. And the next important one is insight. What is the meaning of insight? Awareness of the illness. If you have an illness and if you know that you have that illness, your insight is present. And if you are sick, if you have an illness and you are not even aware of it, we say that the insight is absent. Right. Yes, Divya, you're right. All right. So this was a question from the FMG examination 2022. क्या आंसर है? अभी बताया मैंने. A patient was asked to serially subtract 7 from 100. What is the answer? Option D. This was a question which came in FMG examination 2022. और ये भी बता दो, FMG 2020 का क्वेश्चन है ये. A 21-year-old girl suspects that the college principal is making a conspiracy against her. ये आप सबके कैमरा बंद है या मुझे दिख नहीं रहे हैं? Hello, I can see one girl, Divya. बाकी सबने कैमरा बंद कर रखा है क्या? अच्छा. Now I see Drishya. Very nice. हाँ जी अखिल. हाँ जी अखिल, आप बताइए क्या आंसर है इसका? क्वेश्चन नंबर 2. अखिल को यार अनम्यूट कर सकते हैं क्या हम लोग? मुझे सुनाई देगा क्या? नहीं, अनम्यूट नहीं कर सकते. हाँ जी अखिल,
Delusion
बताइए
of-
what is the answer?
Delusion of persecution.
And why do you say so?
Sir, this is for in the question,
Hmm.
principal is making conspiracy against her. So she is thinking that peoples are against her.
Right. So this is delusion of persecution. Very good. Answer is option A. Now, Divya will tell me, Divya, what is this? Othello syndrome? Yes, Divya. Divya को कोई unmute कर दो यार. Shubham, can I unmute?
Yes, sir.
Divya,
Sir,
yes.
this is the false belief of a husband or a male partner thinking that his female partner is not faithful to him or him, and this is in reference to the Shakespearean Othello tragedy, that in which Othello killed his wife, thinking that she is unfaithful.
And can it be the other way around also? The
Sir, then
wife
that
may
is
think,
not called Othello then. That is called something else.
what is it called? All right.
I don't remember.
So that is very rightly said by Divya. So Othello syndrome is basically delusion of infidelity. So basically the patient believes that the partner is cheating on me. The partner is cheating on me. So it can work both ways. A husband may feel that wife is cheating on me. Wife may feel that husband is cheating on me. And as Divya very rightly pointed out, Othello is a novel by whom? Chetan Bhagat. By whom, Divya? It's a novel by Shakespeare. It's a novel by Shakespeare where the protagonist believed that the wife is cheating on me. Yeah, it's Shakespeare. Right.
Yes, sir.
Correct. So the answer is option A, delusion of persecution. All right. Let's talk about the next topic, schizophrenia. Let's talk about the important concept from this chapter. All right. So we'll directly go towards the etiology and the pathogenesis. Now, the simplest hypothesis is that excessive levels of dopamine causes schizophrenia, right?